This is a presentation on back pain health for the iReach program. iReach program is supported by the Health Resources and Services Administration of the U.S. Department of Health and Human Services. The contents are those of the authors and do not necessarily represent the official views of nor an endorsement by HRSA, HHS, or the U.S. government. At the end of this presentation, I hope you understand overall back pain, difference between acute and chronic pain, types, symptoms, and comorbidities of chronic low back pain, and how to seek help for back pain. Okay, so let's take a look at some numbers about back pain first. Back pain is the most common pain condition in the States as well as in the world. 9 out of 10 people experience back pain sometime in their life. To date, more than 540 million people experience back pain, and then this is estimated to continue to rise up to 843 million people by 2050. Back pain is a major contributor to disability, reduced quality of life, and healthcare burden. To better understand about chronic low back pain, in this slide I'm going to talk about the difference between the acute and the chronic pain. Acute and subacute lower back pain are essentially the same physiologically, and they usually defined as pain lasting from a few weeks up to 12 weeks. Acute lower back pain is actually normal physiological response which is related to the tissue damage or injury. Pain resolves when the tissue heals or the threat resolves. In terms of the etiology for the acute lower back pain, pain is due to the tissue damage and inflammatory response. Therefore, the acute pain is a symptom due to the tissue damage or inflammatory response. While the chronic low back pain is different from acute or subacute low back pain, chronic low back pain is usually defined as a back pain lasting more than 3 months. And then original tissue damage may be no longer the main cause of the back pain. Since the back pain that are already lasting more than 3 months, the back pain actually persists beyond the normal healing time. Therefore, the chronic low back pain is physiologically abnormal. Etiology of chronic low back pain is multifactorial, involving not only issues or tissue damage inflammation at the location of the pain, which is back area, but also other things, including abnormal changes in neurons and psychological factors, which I'm going to talk about in a minute. Since chronic low back pain is the pain beyond the healing process or healing time, chronic pain is usually considered as disease rather than symptom due to the original tissue damage. In terms of symptoms and comorbidities of chronic low back pain, the four most important and the main symptom of chronic low back pain is back pain, which occurs with or without radiating pain to the buttocks and legs. Cause of chronic low back pain can be not only issues such as tissue damage or inflammation at the back, but also other issues. The other issues or causes of back pain can include changes in neurons in the nervous system that become sensitive, which lead to an increase in the pain perception. Furthermore, if the neurons in the central nervous system is involved, the patients with chronic low back pain may also have widespread pain. Pain is not only at the back area, but also other body areas. Furthermore, those people may also present with hypersensitivity not only to the pain itself but also other sensations such as touch, light, and odor. These changes in neurons in the nervous system causing this increased pain perception or hypersensitivity in those other sensations are usually, or sometimes at least, are associated with traumatic life events or PTSD. Chronic low back pain also have a number of comorbidities, including depression, anxiety, poor sleep, emotional distress, and chronic opioid use, known as opioid use disorder. So now I'm going to talk about how we can treat chronic low back pain. There's a number of chronic low back pain treatment guidelines published from a major scientific organizations such as WHO and CDC. And then I have listed a common treatment approaches for the chronic low back pain that are recommended or conditionally recommended in this slide. Those include NSAIDs such as aspirin, ibuprofen, exercise, physical therapy interventions such as joint mobilization, cognitive behavioral therapy, education such as pain neuroscience education, psychological treatments, needling therapies such as acupuncture. Those are recommended or conditionally recommended to treat chronic low back pain symptoms. Those treatment guidelines also listed a number of treatments as recommended against. These include opioids, especially chronic opioid use, lumbar braces, belts or supports, lumbar traction, and pharmacological weight loss. These are repeatedly and consistently recommended against by a number of treatment guidelines. Furthermore, transcutaneous electrical nerve stimulation, known as TENS, therapeutic ultrasound, general weight loss, or injectable local anesthetics, those are also not recommended because there's no or little evidence supporting a treatment that may be effective for reducing your chronic low back pain. To have better treatment effect for your symptoms, we should pursue the treatments that are recommended by those guidelines. However, it is important to note that everyone's symptom is different. Even if, for example, all of us have chronic low back pain, our symptoms are actually different from each other. Also, everyone has different responses to the treatment. Therefore, it is vitally important to ask your healthcare professionals, such as physicians and physical therapists, about the best treatment options for your symptoms. There is also a number of online resources that are helpful to manage your symptoms. Those include U.S. Department of Veterans Affairs, U.S. Pain Foundation, CDC, and IASP, International Association for the Study of Pain, and etc. So I strongly encourage to look into those online resources to best manage your symptoms. With that, I'd like to conclude my presentation. Thank you for listening, and please also check other educational resources at iReach program, covering various topics related to veterans health. Thank you.